Before we get started in this episode, a quick announcement. As you know, I'm very passionate about acceptance and commitment therapy, and I also run a busy practice in Canberra. We're currently looking for psychologists who are registered in Australia to join our team, who are also passionate about learning about ACT. We provide supervision on a group and individual basis and training around ACT. So if this is you, if you're interested, please express your interest at strategicpsychology.com.au/careers. Look forward to hearing from you. And now back to this episode.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking, yeah, better thinking. Time to tune in. Let's go.
Welcome back to Better Thinking. My name is Nesh Nikolic, and today's guest is Dr Michael Carr-Gregg, who is one of Australia's highest profile psychologists and author of 14 books. He's also a broadcaster and a specialist in providing corporate mental health support for families, parents, children, adolescents, and really enjoys the space of technology in mental health, such as apps and Etherapy. Michael's on the show today to talk about what he dubs as a crisis in mental health in Australia, but it gives some really practical ideas and antidotes as to how we can all address this, not only as psychologists, but community members and potentially us who are also experiencing mental health difficulties ourselves. So some really great advice and opinions and thoughts, quite thought-provoking from Michael, and I think you're going to really enjoy this particular episode. Ladies and gentlemen, please welcome Michael Carr-Gregg. Michael, a big thank you for coming on to our program today to talk about the mental health crisis in Australia. I know this is something you've spoken about before, and I thought it's a really good opportunity to invite you on and to talk about your experience and obviously knowledge and research in this area, having done so much throughout Australia.
Thanks, Nesh. Good to be with you.
Tell me a little bit about what's meant by the word, crises. I know that it's a large word, but what's meant about, crises in the context of mental health?
So we know from the research that 1 in 5 adults, 1 in 4 teenagers, and 1 in 7 children have a mental illness. A mental illness is something that interferes with the thoughts, and the behaviours and the feelings of people to the point where it interferes with their functioning. And before coronavirus, things were pretty dire, and the crisis stemmed from the fact that 65% of those people did not get any treatment at all for their mental illness, none whatsoever. And to me, that's a crisis, because it means that at any one time, you got 65% of people with the mental health problems not getting the help that they need. And that's going to impact not only on themselves, but on their friends and their families and their capacity to work. So I guess in a nutshell, that's the crisis.
And is this something that's unique to Australia? Is there a global trend that this is, going by? Has Australia been this way in the past? What's going on?
Well, there are two questions there. One is it a trend internationally? And certainly in Western nations, all my colleagues who are child and adolescent psychologists say it's the same or worse. Nowhere is it better. And I guess with respect to has this always been the way? Well, we don't actually know if it's always been the way because we don't have the data. The data we're operating off at the moment is a 2007 National Mental Health Survey. And the scandal there is that the government said that they'd be conducting this thing every 10 years. They didn't do it in 2017. They haven't done it in 18, 19, and they certainly haven't done it this year, which is quite extraordinary because you actually think about the fact the whole mental health care system is based on 2007 data. So it's data that's 13 years old. So it's really quite an extraordinary situation that we find ourselves in. And I think some of the politicians and some of the general public have what I call mental health compassion fatigue. So they'll listen to someone like Ian Hickey or Pat McGorry or myself, and they'll go, oh, they're those mental health advocates yapping on again. But it's not until it affects them that suddenly it becomes a big issue.
It's absolutely astounding that the data we're using is from 2007. It doesn't fill me with much hope in terms of trying to address a national problem using really outdated measures and data to tell us what are the trends, how can we go out and improve our healthcare. I mean, I know that the government has very recently, in response to coronavirus, added in mental health care plans and the primary sort of access to mental health an additional 10 appointments. And obviously that's more than welcome. That's incredible. I think it's a fantastic step forward and certainly goes in line with, continuity of care and best practice. But I would like to think that we've got a little bit more data that we're kind of using to inform what do we do next.
So I think the problem is that the mental health care system is a little bit like a traffic jam. And I used to grow up in Sydney, and I remember we used to go on the Pacific Highway. Now, I don't know if the Pacific Highway through Gordon and Pymble is still essentially 2 lanes, but it was completely clogged. And so I'm saying that our mental health care system has a supply and demand problem. And that is that we don't have enough services for the people. So we have a system which is completely clogged up. We wait till someone is desperately, desperately unwell, and then we try and find them a place in a system which is completely and utterly clogged up. And generally speaking, they don't get absolutely optimal care. And what the government does is that they build new lanes on the highway. But because of the supply and demand problem, those new lanes clog up really, really quickly. So I don't think we can build more headspaces or make more sessions available on Medicare our way out of this. I think we need a much more nuanced approach, and I think our approach needs to be more heavily reliant on Etherapy, which I'm a great fan of, and also we need to focus on prevention and early intervention, because I'm waiting to go upstairs to my clinic today. I live in Melbourne. The last 9 months have been a nightmare for all of us, in that there just simply aren't enough hours in the day. And I'm getting phone calls from desperate parents with, I'm a child and adolescent psychologist, kids self-harming, kids locking themselves in the room. It's just been the worst year of my 25 years of clinical practice. It's just appalling. So before coronavirus, it was pretty dire. I think Pat and Ian have talked about this second curve. I think the second curve is going to hit with great ferocity in about a month's time, because we'll get the fallout of everything that's happened over the last 9 months here. I don't know what it's like in New South Wales or other states and territories, but it's pretty dire here.
When you say the second curve, are you talking about a mental health curve or as in more coronavirus cases?
No, I'm definitely talking about mental health.
Yeah, so that there's going to be a flood, a wave of impact that's come from, the lockdown and the like.
So Pat and Ian's modelling, which they did at the beginning of the halfway through the first lockdown, said that there would be, worst case scenario, an additional 1,500 suicides throughout Australia. Every year there are 3,000, so that's effectively a doubling. The best case scenario that they could see was about maybe 700, 800 new suicides. Either way, that's terrible. What I'm seeing is an increase in anxiety disorders, mood disorders, substance abuse disorders, domestic violence, an exacerbation of parenting issues. And for my particular cohort, which are teenagers, there are only 4 things that they need to do, Nesh, and that is they need to make friends, they need to go to school, they need to figure out who they are, and they need to basically emancipate from their adult carers. All 4 of those key developmental tasks have been massively thwarted by the coronavirus, by the lockdown, to varying degrees in varying states and territories across Australia. But you don't get away with that. There's no way that there's not a cost to all of that. And I think that's what we'll bear in the next couple of months and years ahead.
You mentioned that the current approach is to try and build more lanes, but obviously the volume of traffic is so great that those lanes just get completely consumed again, and we're in the same situation. You mentioned a few alternatives such as Etherapy and sort of prevention, ground roots, sort of early intervention sort of work. Can you talk us through a little bit about some of the specifics of where you think it would be useful to put resources, if we could change the model?
So I think psychologists need to be better trained in Etherapy. I think the vast majority of my colleagues probably don't use the apps, the websites, and the biometric devices which exist, which are particularly perfect for my cohort, but also for an adult cohort. And I'm talking about organizations like, websites like Mood Gym, for example, which is cognitive behavioral therapy online, the adult equivalent, which is eCouch. These types of evidence-based programs that are found to be really effective for mild to moderate anxiety and depression. They need to be heavily promoted. There needs to be a really significant budget around advertising them in the same way that you'd advertise, I don't know, Coke, because to me that this is really, really important. The fact that they're free, they overcome geographical boundaries, they are evidence-based, and they get around the problem of stigma, means that they are the logical go-to choice. They exist. The federal government has a portal for all of these things called Head to Health, but it's not heavily promoted, and it needs to be really up there. I think when it comes to our training as psychologists, whether you are a clinical psychologist or whether or not you're child or adolescent or a counseling psychologist, you've got to learn how to use these amazing apps that exist. When I was on the board of the Australian Psychological Society, I frequently ran workshops called "Is That a Psychologist in Your Pocket?" And what I'd do is go through the top 10 apps that I'd use on a regular basis with my clients. And a lot of them are really simple, very straightforward things. Mindfulness meditation through Smiling Mind. ACT through that little app called ACT Companion. Apps for exercise like Couch to 5K. um, apps for sleep and relaxation like Calm, the 2017 Apple App of the Year. There are a whole range of them, but it is just incredible how many of my clients, I have never heard of them. And these are clients who've been to screens of psychiatrists and psychologists. So that's one aspect, the whole e-therapy side of things. The other thing is prevention. This is really about getting into our schools, because I'm a child and adolescent psychologist, and teaching kids the skills and the knowledge and the strategies and the emotional literacy that they don't get. The curriculum is so cram full of stuff that, in my humble opinion, will never be used by these young people when they hit the workforce. And yet, one of the most important life skills, it would have to be things like conflict resolution, anger management, problem solving, decision making. They're not taught at all, Nesh, and that just doesn't make any sense. So how do you equip our young people for the future if you don't give them these valuable skills?
You've got very compelling arguments in both cases. I think what you say about, this e-therapy is not really an issue of availability. It's an issue of promotion. That there's lots of great resources, and we need to give people confidence that they're going to the right place. I can imagine people who are in hardship, who are going through a difficult time, being lost in the world of mental health. You want to go see a specialist, and so you immediately see a doctor, and the doctor says, see a psychologist or a psychiatrist or whatever it might be, and so you're dependent on an hour-to-hour consult versus being able to do your own time, your own work, and understand yourself better through an infinite amount of resources. You're kind of saying, if we can place, we're not trying to replace psychologists by any means. We're trying to take the burden off the traffic jam, and say some people might not even need to get onto the road if there is enough support there for mild to moderate experiences and cases that could give them life skills purely through their own work, and rather than jamming in, I'm assuming, countless of millions of dollars in promoting Headspace, which is a fantastic service, but you're only just adding to the traffic jam rather than saying, maybe we've done enough there, or we can continue to do some there and some to these other resources.
Yeah, I mean, that's a very good summary, absolutely. And it's the versatility, the fact that people can access these particular programs when it suits them, not when it suits me, and or their clinicians. So absolutely wrong.
And therapy would have to go and agree with this, because we all know that when you're seeing someone for an extended period of time, you're only hearing one psychologist's voice, one psychologist's train of thought. We ourselves get stuck into, our own little niches and paradigms and our language sets and so on, versus to be able to hear it from a different app, from a different developer, different platform that it's provided, goes out and enriches the experience or the opportunity to learn, over time. So sounds great. The other thing I want to pick up on, what would the topics be? You did mention a few, like conflict resolution. This all makes so much sense to me. What would the topics be that you would want to have in the curriculum that we could spend, a term on, or even a semester on, or potentially, across the board, where each year we spend a bit of time with our kids in particular, because obviously I think ground roots is most important in early intervention. What would you like to the topics and what would be within those topics that we could teach, whether it's psychologists going in or assisting teachers to do part of that job as well, because, you'd need to work hand in hand if you're going to do something Australia-wide.
I think probably the truth is students learn teachers, not subjects. So part of this is to make sure that the teacher's mental health is pretty good, that they model good well-being. So the sorts of things that I would want the teachers to talk about would be the building blocks of well-being. So diet, exercise, sleep, and relationships. Almost more than a decade ago, I had a meeting with Marty Seligman, and positive psychology was in its infancy, and someone had told him that I was the Dr. Phil of Australia, which is complete BS. But he decided that I was worth talking to, and he said to me, the key message that you've got to get across to everyone in Australia is that the greatest predictor of well-being was not being good looking, was not being wealthy, was not having more good experiences than bad. It wasn't really even about the amount of talent that you had. He said the greatest predictor of well-being was having a rich repertoire of friends. Now, that's a slight oversimplification, but certainly if you look at the positive psychology literature, there's a lot of evidence to support the importance of relationships. So I think in addition to diet, exercise, and sleep, we need to emphasize how to obtain, maintain, and retain friends. And a lot of kids don't know how to do that. I think a lot of adult human beings don't know how to do that because they've never been taught. I was always taught by my mother that friends were like a garden. They needed to be watered, and that you only ever got out of a relationship what you put in. I think these are fundamental truths. And so relationships, I think, are way more important at this stage than calculus or quadratic equations. Or I remember what I was taught endlessly at school when I was in Sydney, which was about the tundra, which I've never used in my life. Treeless plains with freezing weather. Why did I spend so much time learning absolutely useless information? So that's number one. With respect to diet, I'm a great fan of the work of Professor Felice Jacka at the Food Mood Centre at Deakin University. So the last 10 years...
Food Mood
Centre. Okay. Yeah. The last 10 years, she published an article in the American Journal of Psychiatry in January 2010. And I met her around about the same time. And what she was positing was a whole new school of thought, which she called nutritional psychiatry. And I remember going to some of the sort of traditional psychiatrists at the time with whom I worked, and they poo-pooed it and they said, no, this is nonsense. But in fact, her research team has shown that it's not nonsense, that, for example, a modified Mediterranean diet given to a group of people who were depressed and have a control group who just ate a normal diet, we know that there was a significant difference between the control group and the group that were eating the modified Mediterranean diet to their scores on depression. So from my point of view, if ever, when I go upstairs today and start my clinic, whenever I get a young person living with a mood disorder or an anxiety disorder, one of the first things I do is I check out their diet, because clearly Felice has shown that high fat, high sugar, high processed foods are not good for you. And the whole gut-brain connection has now been well established. I think that's probably one of the most significant advances in modern medicine. So I think we need to teach kids early on about, while they're brought up with a muck diet and they're bombarded with advertising for fast food, in association with various sports. We're about to have a cricket series sponsored once again by KFC. And I think that association between sport and food is highly undesirable, fast food. So I think teaching them good food habits is great. With respect to sleep, well, I mean, this is one of the great, I think, public health dilemmas for us psychologists at the moment, because people don't get enough sleep. They spend way too much time staring into screens. I'm a great fan of the Professor Russell Foster, who's the Professor of Circadian Studies at Oxford University. And I don't know whether you provide links to these talks, but he's got a TED talk called Why Do We Sleep, which is superb. I don't know if you've seen it, Nesh. It's brilliant. And he talks about everything that we really need to know about sleep, but the basics for kids in school, for adults in a workplace. And I've started doing a bit of workplace work with, dim the lights half an hour before you go to bed. Don't drink, huge quantities of coffee after 1 p.m. Make sure you sleep in a room which is cool, dark and quiet. Make sure that you don't have a big argument with someone before you go to bed. I mean, these basic pieces of sleep hygiene, that needs to be taught as well. And exercise, just to finish off, terribly important. There's a brilliant book, I don't know if you've read it, called Mind Rules by John Medina. And in it, he cites a piece of work which clearly shows, it's called the Harada experiment, clearly shows the connection between exercise and good mental health functioning. And we know from Beyond Blue that a really good part of any good treatment program for someone with an anxiety disorder or mood disorder is exercise. So that's the sort of stuff we should be putting in the curriculum. Long answer, but it's what you asked for.
No, absolutely. The challenge that keeps popping up in my head is these answers are almost taboo. It's like, how can I go to a psychologist? How do I even convince my colleagues that sit down with clients and talk about diet? I mean, we know the data's there, but why is it that would be so hard and complicated for? I mean, I'm projecting, but I just feel like even psychologists would feel uncomfortable with having that conversation, and clients wouldn't be comfortable. But it's so important that we need to actually put reality on the table and say, yes, diet is important, and let's examine it. Let's look at it, because it is impacting your mental health directly. This isn't an indirect, assessment. I know that obviously in research we only do, we don't do causation, we do correlations, but there is a direct effect here.
Oh, no doubt. And I think that we have to really have a reality check, because I think a lot of people think that we've overcome the stigma associated with going to a psychologist, full stop. And we don't. Before the coronavirus, I was flying to Perth to give a talk, and I was sitting next to a person, and we were engaged in a very nice conversation. And they asked me what I did. And when I told them that I was a psychologist, they sort of reeled back in their seat and said, well, have you been analyzing me? And I mean, not until just right now. But I think that Beyond Blue, Sane, Are You OK Day, they're all fine, but I'm not sure that they've actually reduced stigma to a significant level. And I'm still coming across attitudes which I would argue are antediluvian, which are very similar to the attitudes, values and beliefs that my father had about psychology as a World War II veteran, which is that why would you pay anyone money to talk to them, which is, the old school.
How do you think we should approach stigma, trying to remove it, normalizing, being human and having some difficulties and troubles?
I think we've got to go where our clients spend a lot of time, which is social media. I think we've got to have people who have lived experience with mental illness talking more. I'll give you an example. The greatest piece of behaviour change that I've seen in the last maybe 5 years occurred at PricewaterhouseCoopers. So what they were looking at were their referrals to EAPs, and they were actually quite low. And we know in a workplace that at least 1 in 5 people are going to have either depression, anxiety, or a substance abuse disorder, and about 0.5% might have psychosis. So that's what the statistics tell us going back to 2007. What they decided was that that was impacting on their productivity. They had a lot of presenteeism and they wanted to do something about it. So they pinched an idea from PwC UK, which is where they spoke to all the most senior members of their staff. So we're talking partners. And they had 800 partners across Australia. And they basically put out an expression of interest saying, look, have any of you guys had a lived experience with mental illness that you would be prepared to talk about publicly within the firm? And they got quite a few people come forward. I was asked with a colleague to whittle those down. We chose 9 of those partners. We made the most beautiful, high quality video productions where they told their stories, beautifully produced, incredible production quality, something that I've almost never seen before. And the program was called Green Light to Talk. And these 9 individuals were scattered across Australia, and each of them wore a green ribbon. The whole firm wore a green ribbon for months and months. And it was a reminder that if anybody had any issue, they didn't have to go to their manager, they didn't have to contact an EAP, but they could just go straight to one of these senior partners who had shared their story on the PwC intranet about what was happening with them. And we launched this program. PwC decided to use me as a reasonably well-known psychologist in Australia to launch the program. I gave a 45-minute talk about well-being and apps. If you turned up to that talk, which was the launch of the PwC talk, we showed one of the partners' videotapes as a precursor to my talk on well-being. And if you turned up, you went into a draw for lunch with Hugh Jackman, whose father used to work for PwC. And I went right across Australia. And this has proven to be one of the most amazing programs. So what's so great about this is it was policy, not from the kind of right at the top. We were basically being really inclusive. We're saying, look, we've got senior people who are here ready to help you. We trained those 9 people for a day, essentially in mental health first aid, which I'm sure you're familiar with, which wasn't, trying to turn them into Dr. Phil, but trying to give them the skills and the knowledge and the strategies to direct the people who did come to them to the appropriate place. So for me, that's a really brilliant idea. Why could we not do that in every single firm right across Australia? And it could be a government initiative where we go to every single company and do that model. I think it works very well.
What are your thoughts about the likes of people like Jeff Kennett, who have openly spoken about their own challenges, or more recently, Malcolm Turnbull, Does that have that impact as well, or do you think it has to come from someone who's a little bit more accessible, where it's partner of a firm? Where's your mind at with that? Because I think modelling is so important, and it just normalises without trying to do so. It's just an open conversation saying, "Yes, I am human too."
Yeah, I think both of those figures are highly polarizing, Nesh, and they come with a lot of baggage. So personally, I know and like Jeff. I'm a patron of the Hawthorn Football Club, which he's president of. So I've been on the Beyond Blue journey since it started, heavily involved at the beginning. But I think he's a politician, and so's Malcolm. I actually went to school with Malcolm in Sydney. He was about 3 years ahead of me. But again, he's a highly polarizing person. So the model,
How about
I agree.
Ian Thorpe? My apologies. How about like an Ian Thorpe?
Yeah, Ian Thorpe, again, a little bit polarizing. The kind of model I'm thinking of is a Kiwi example, which is Sir John Kirwan. Now, he was an All Black, and the beauty of John Kirwan and his depression awareness program was that he appealed to virtually everyone in New Zealand because that's their religion, rugby. Unfortunately, we've got so many codes in Australia that you can't just rely on one sport. And you can't have someone, I think, who's an ambassador for more than one thing. So I think Ian's done a fantastic job talking about gender issues, and I think that's sensational. I think you kind of confuse people if you get them to talk more about other stuff. And I know he's been talking a lot about mental health issues, but the truth is he is polarizing because of some of the news reports about what he's alleged to have done in the past. So I want someone who's squeaky clean, who doesn't carry that baggage. We once did a survey when I was on the board of the Alana and Madeline Foundation about who would be the best person to talk to in Australia about about bullying. And the firm that we employed to do that said it's so difficult because we came up with Rove McManus. And Rove at the time had a TV show, and he was kind of like the ubiquitous good guy, but he appealed to a particular demographic. And I think the difficulty we have is we've got to choose our demographic. Is it old? Is it young? Is it retired? Is it middle-aged? And different people will appeal to different things. The brilliance of the John Kirwan choice was that everybody in New Zealand loves rugby and loves the All Blacks and loved him. And the fact that he was able to come out as this big, tough, amazing athlete and say, no, I wanted to kill myself, that's just gold. We just don't have someone who has that status in Australia.
Just a thought that came to mind while you were speaking. I wonder if it would be even more effective if we slightly shifted away from talking about, my mental health to those contributors that you spoke about. So having spokespeople who, for example, talk about the difficulty I had in parenting, or the difficulty I've had with staying up late, being on social media and not getting the sleep that I need, or the difficulty I have in, managing a well-balanced diet and, my journey through doing so and the improvements that I've made. It's almost like at the moment we've got an awareness campaign which says, yes, I've, suffered with anxiety or depression or whatever it might be, but we don't necessarily say, yes, I've experienced staying up late at night, or I've eaten really poorly for a long time and put on a lot of weight, or, I was lost as a parent and yelled at my kids, and this is how I've kind of turned the corner. We almost kind of use categories rather than life experiences from day to day. I wonder if we could potentially use exactly what you're saying, but I know in therapy we would be looking at it much more specific, whether that would potentially have value of having a public figure saying, yes, I'm on Facebook till late at night and then I don't perform very well the next day.
Yeah, no, I think that's a fabulous idea. Again, it's a matter of what's your market, and how complicated the message is. I mean, it's so interesting to me. I think it was about 10 years ago, Dr. Phil came to Melbourne, and because I worked for the radio station that sponsored him, I got to spend an hour with him at the Rod Laver Arena. And it's so interesting because he's another sort of fairly polarizing character. But he told me a couple of things I've never forgotten. One is that he was no longer really a psychologist. He was now an entertainer, and that he'd given up his registration. But he told me that he once was a psychologist, and he showed me the link to his PhD, which was actually very good, on the impact of arthritis on young people. And I wrote my PhD on the impact of cancer on young people. And I was very familiar with the chronic illness space, and it was a good PhD. What he said to me is that our profession had really not done a very good job of promoting itself, which I actually agree. The truth is that there are a couple of very high-profile psychiatrists in this country who essentially own the mental health narrative, and that the media listens to a lot of the time. I would love to see the various organizations that represent psychologists have a much higher profile, be much more vocal, and talk about some of these things that you're talking about. At the moment, either the Australian Association of Independent Psychologists or the APS, whichever group you belong to, they really don't have a very high profile. And I think we would do so much better if we did have some spokespeople who were talking about the things that you were talking about in an authoritative and in a sort of very commercially acceptable way.
It's interesting that it seems to me that the flavour of what you're saying is this is very much a challenge around distribution of thoughts, of getting good ideas out there for the public to be able to access. And at the moment, even though there's an abundance out there, there isn't a very good job that we've done in promoting where to specifically go, because people who are lost don't know where to go. So you just end up Googling, but you can find yourself anywhere, and there's a whole lot of rubbish out there, versus being able to say, go to a peer-reviewed program that's got some research behind it that this university has looked at, and we can see it's evidence-based, and there's 15 other options, or 100 other options. Take the burden away from an hour-to-hour consultation need with a psychologist. Not saying that's not another avenue, but being able to reduce the traffic on the roads. We need a better campaign in psychology of talking about these things, and whether that be that I've gone through that, and you can speak to other people, or specific things like sleep, diet, exercise, having a good network of friends, family, bonds. All of this conversation is important, but something with a little bit more practical use rather than just, yes, I also experience it. Yes, I also experience it. Yes, I also experience it.
Yeah, I mean, I think what we need, to be honest, is a PhD that can speak in sound bites, but that those sound bites have an evidence base. And you're so right about everything on the internet and how confusing that is. I had a teenage client come to me a few years ago, and they brought me a little USB, and on that USB, they downloaded some really slick videos that they'd been sent from the United States, and they had been made by the Church of Scientology. It's not a great fan, as you know, of psychology or psychiatry. And these were ads which basically showed a mother and a son in a doctor's office, and the doctor was basically explaining how the antidepressant medication that they held in their hands were responsible for the mass shootings that occurred at Columbine and at various other places. So this was a completely spurious, completely fact-free exercise, but this kid had got this off the internet and was absolutely clear that they should not take the fluoxetine that had been prescribed to them, quite appropriately, for a really savage mood disorder, strong family history, self-harm, attempts at suicide, the whole thing. It was like a totally appropriate part of the treatment, along with talking therapy. But they had downloaded this absolute garbage from the internet and were confused. So, we got to cut through that, Nesh. We need a really strong, united kind of message on all of the, we know what the major problems are. We need to really have a united message. And the media aren't our friends in this. Their reporting, for example, of suicide leaves a lot to be desired. You don't live in Melbourne, but just yesterday, on the first day of our Year 12 exams, on page 4 of the equivalent of your Daily Telegraph, the Herald Sun, was a full story on a young person who had taken their own life, and the timing was appalling. Now, the only saving grace is that they didn't violate all the mind frame guidelines on the reporting of suicide, in that they didn't say how they did it. They didn't show pictures of, the person having taken their own life. But it was still terribly confronting, and the timing was awful. Media also promote this whole idea that people with psychosis are violent, where in fact, as you know, they're far more likely to be victims of violence than perpetrators of it. So we've got to do something about the media reporting of mental illness as well.
How can we do it? Obviously, you're in the media a lot. What would the tips be that you would speak to our colleagues, psychologists or even people in the community? What can we do better to start getting this message out? That's more than just awareness. That obviously transcends awareness, because there's plenty of awareness out there. What can we do if we get the opportunity, to have our voice heard a little bit more, even if it's on a one-on-one basis?
Well, I think we need to make the opportunity. And I have for a long time run courses for psychologists on how to deal with the media, how to put together a press release, how to speak on radio, how to give a reasonably entertaining and interesting performance on television, write op-eds for the newspaper. I'm very fortunate in that I've been around for a long time. I've got a regular spot on the #1 radio station in Melbourne. I've been the parenting expert for Sunrise for 15 years, and I'm in the little black book of a lot of reporters, and I respect deadlines. I never talk outside of my area of expertise, and will generally refer the reporter to someone who has subject expertise. And I think that's our job. We need to be approaching them. We need to educate them. I think, again, I look at the training. I don't know where you trained, Nesh, but I got most of my training undergraduate at Sydney University and postgraduate at the University of New South Wales. We never got taught anything about media or public policy advocacy, and I think that's a shortcoming in our training. I think that anyone who is going for a postgraduate degree in psychology, including and especially the researchers, should be taught how to translate their research, which obviously often they've got public money for. They need to translate that into English and be able to convey those results to radio, TV, and newspapers.
I think it's very well said in terms of that proactivity for it's. In actual fact, this is about psychology, the industry being proactive and putting it forward rather than, in some sense, hoping for the best and hoping that media does the job well when, you know, their interests might be a little bit different to ours and they don't have our insights. So I think that's so on point. We as an industry need to do better. I'm actually going to have to call you on that and speak to you after this about how I can maybe do my part, because I think, you know, psychology has so much to offer, but we've got to be much more, you know, direct and succinct and put out a good message to be heard and understood. Otherwise it just gets lost in all the noise.
Couldn't agree more. Happy to take your call.
Lovely. Well, Michael, we could talk for ever and ever. Just before we finish, what are your hopes for, you know, mental health here in Australia for the future? What would you like to see happen in the next, you know, 10 to 20 years?
I think my biggest wish would be to introduce legislation into the Federal Parliament of Australia, which basically does this. In every organisation at the moment, there's essentially someone who's a designated first aid officer. I think we need to have a law passed that in every organisation with more than, 25 employees, they have to have a mental health first aid officer, and that person has MHFA training, and that you cannot essentially register a business unless and until you have such a person trained, and preferably two. So that, to my mind, would be a way of really beginning to turn things around at the coalface. And in order to accommodate the demand, which would then be generated through early identification, prompt diagnosis and speedy treatment, I would want to see a mental health tax introduced, preferably funded by the alcohol industry in Australia, so that for every single bottle of wine that Nesh, you and I might have when I'm in Sydney next, or a low alcohol or no alcohol beer, in my case, for every single container that we use, 10 cents is hypothecated to a fund which goes to fund a proper mental health care system in Australia, because at the moment the funding isn't there.
I'd second that. I think having a fund is important. I know that everyone panics the moment that a tax, the idea of a tax comes up, but that's the only way we're going to tackle this. And I love the idea. It's practical. It makes sense. It's ground roots. It says people on the floor who are there to support, who are well trained, and that is really early identification and early intervention. And it also marries up having that network of support around you immediately. So if someone isn't well connected, at least they've got that in the workplace. Some really practical ideas. Michael, I really appreciate it. I know I've got to let you go so you can get back up to your clinic and continue on with your day. Incredibly busy man. But I really appreciate you coming onto the show and talking about everything, mental health and more, and really having some great practical suggestions and ideas.
Thanks very much, Nick.
If you enjoyed this podcast, please support it by going to iTunes and putting a review, subscribe, share it via social media, and tell others about it. Start a conversation. It's listeners like you that make this able and possible, and why we bring in these guests to go out and share their knowledge and resources. And just lastly, if you are a psychologist and you want to go out and be part of a bigger team, develop your experience and get into some exciting work, come to strategicpsychology.com.au/careers and reach out. I'd love to hear from you.